Shakti, the model of a community-based rehabilitation program for survivors of trafficking in West Bengal, was initiated in 2016. Before that, between 2012 and 2015, the context in the communities was survivors of sex trafficking rescued and incarcerated in shelter homes for years returned to their families to fight stigma, poverty, and violence. Vocational training and non-formal education in shelter homes were useless in finding employment. Survivors kept quiet, fearing stigma even when they found that the police had not indicted traffickers in their home states. These traffickers enjoyed impunity and continued trafficking. Distress marriages led to domestic violence, stigma, and suicides. NGOs and the government imposed the custodial approach on survivors, which was ineffective. This human rights abuse remained unchallenged by anti-trafficking activists or financiers. The government had no policy alternative. Survivors had no voice. In 2016, Shakti came as a radical shift from the custodial approach to a community-based rehabilitation model that focuses on client-centric case management system, survivors in charge and control of determining their rehabilitation plans. Rights-based model, focus on access to service availability, delivery by state duty bearers, builds systemic accountability. Support survivors' leadership, formal application of services, escalation of non-responsiveness, challenges through deputation and media reporting. Non-hierarchical partnership between social workers and survivors. Technology use for robust evidence organizing, performance evaluation of duty bearers and NGOs as service providers. The impact in 2020: increase in survivors' access to health, welfare, legal and livelihood services, drastic reduction of PTSD, reduction of stigma and family violence, improved resilience, increased claims for compensation by survivors, and survivor-led actions to prosecute traffickers, leading to deterrence in crime of trafficking. State and national governments and political parties have stronger policy engagement with survivors. State now has a policy alternative to custodial approach, which is CBR, community-based rehabilitation. Shakti, reimagining the rehabilitation, resilience, and empowerment model for survivors of modern slavery.